Hi guys. So the United Healthcare stock fell today a little bit, like 9%, on the news of Wall Street Journal just reporting that the DOJ investigates now the Medicare billing practices. Okay, at United Healthcare. The point they're trying to make is that they say that basically what UNH is doing is that in the Medicare Health Advantage system, insurers get lump sum payments from the federal government to oversee enrollees' medical benefits. So they are just piling up further and further diagnoses to make a bigger bill for the customer, so that customer who gets paid their medical expenses from the side of Medicare Advantage system, who is a customer, the people who are Medicare Advantage system customers or users, um, which have this plan, they claim their money from Medicare, and Medicare actually pays to the United Healthcare system. So the DOJ is launching an antitrust. I mean, an antitrust is a different long-term thing which is going on. And anyway, the DOJ blocked their 3.3 billion planned acquisition of Medicis, and the DOJ also launched another investigation today. I mean, reported today about that the United Healthcare just piling up further diagnoses, which are probably also not required, and we don't know it's true or not, but this is what they are reporting at the moment. Okay. um, United Health declined to comment, and the exact reasons are not 100% clear. These are just allegations that they just, whenever a patient goes to the United Healthcare, and then they say that, okay, I need a diagnosis, I have a problem. Sometimes the nurses are visiting them, and which also actually cost another 2,000 something, 700 something dollars to the patient, which actually is paid by the Medicare. Like if there's something here, there's a figure. So the point I'm trying to make is that um, these are just allegations. Here it is written: $2,735 on average if a nurse visits um, um, the patient. You know, um, the thing is that how else do you understand a healthcare service provider company is supposed to make money? Of course, they will be making money by offering you and selling you more services, upselling this, that. But this is not necessarily a bad thing. Sometimes a person has a pain in the eye, then they have to recommend you, the doctors have to recommend you, please check your eye pressure, please look into further eye tests, get an ultrasound of the eye. These are further tests which may be required, which all in the opinion of one doctor, and they may not be required in the opinion of another. So another thing, they just said that the doctors, they were paid, like the Medicare billing investigation adds to the scrutiny in the $400 billion company, that the health insurers and sprawling network of the health industry's assets, including doctor practices, large pharmacy. No, this is not it. This is not it. They said that the doctor offices are paid more commission if they can keep adding and piling up to the diagnosis. Some of them, arguably, are not even correct or required, which may be a fraudulent practice. This is again not proven. These are just allegations. Like here, it's one of the most important sentences that the doctors said. The United Healthcare, based in the Minneapolis region, trained them document revenue generating. Trained them to document the revenue generating diagnosis. So just document those diagnoses more, which are revenue generating, which should be every single one of them. Of course, common sense. They are selling you the service, so of course they must be revenue generating diagnoses. They are just trying to make some money off it, including some they felt were obscure or irrelevant. Now this is concerning, that if some are not treatable, there was another point here, they said that some diagnoses are not even treatable, so why are they being added into the diagnosis if they're not even treatable? Like here, like records of conditions that no doctor treated. So these are some allegations. United Health did not comment, of course. The case will go on, but even if they are at fault, then like Google has been charged many times for antitrust practices, and Microsoft and Apple and Facebook and I don't know, every tech company, every other company, and they just end up paying a fine. I don't know, 1 billion, 2 billion, 4 billion, 5 billion, I don't know, something like that. And the point is that this they just made this talk for 10% from where it was already low before. If you see the years chart, it already fell down here. Okay, 20% when the CEO was killed, sadly. And now it's even further down from here, 10% down. This is like 502 price here, and from 502 it further fell down to, I think, yeah, 453 dollars something, 444 euros around, something like that. And this is just crazy, like crazy cheap. The PE, if you want to see the PE of this company, of United Healthcare, yeah, it's already like the forward PE was already around excuse me, image. You can see here oh my god, 10% now. PE for the forward PE is 17. Unbelievable. And 17 was, I think, yesterday, and after falling, I don't know what it is. What is it? It's 15 now, or 10% less. 10% less would be 1.78. 1.7 is like around 2. So yeah, 15. Around 15 now. So around 15 forward PE. That's cheap. It is a dividend paying stock. Not that much big of a dividend, but dividend is dividend. I think 1% or something like that. That's what they are paying. And let's see. Dip. What are they paying? The dividend, I think something around 1%. Yeah, 1.64%. Here it is. Okay, dividend yield. That's where it is. Okay, 1.64% forward dividend yield. Earnings are coming on 14th of April, and I think I'm going to add to this position because I already own this position. I'm not locked in, but we would probably add to this position because these are all temporary issues, and this is one of the greatest buying opportunities like of all time, because I think United Health stock is now, man, like really cheap. It's like 15 times forward earnings and 35%, almost 35% from all-time highs. In the year it's actually down. I think it's not even making anything much in the year. So yeah, basically United Healthcare stock is on sale due to this unfortunate news, and I think we should take advantage of it. Even if things get messy, it's going to be temporary. After 6 months, after a year, this stock is going to give you, oh my god, I guess like here somewhere at the moment, 453. If you see how much increase it is from 453, and what is the top is like 600, could like 700 now, like right now 440, 453. Let's see, 453. So yeah, you have around 35% upside, like for nothing. I think more. I think 40, 30, 35% what it came down, and you get upside of 40%, even 40, 50, 60%. If it goes to 700, actually more, not just 60%, because if it's 400, if it goes to 800 or 900, you basically practically double your stock. Okay, 700 would not be double, would be 60%, something like that, like we just calculated. So 64%. But it's not bad. It's a not bad return for a year or year and a half. I mean, you invest in S&P, average return is like 12%. You buy a bond, you get 4% a year. If you get like 64% in a couple of years or 1 year, it's like a huge return. So I would probably most probably be buying this dip, definitely, because I'm already in the stock, and I will add to my position. And it's probably an overreaction at the moment, because it's pre-market at the moment. It's pre-market price of the stock, where not a lot of people are buying and selling. So whichever few people are selling, the effect is just multiplied and exaggerated and leveraged, based on the limited number of shares available for trading at the moment, because not everybody's buying and selling when the market is closed. Let's wait for the market open. I think people are going to buy it. I will not be surprised if it comes back to somewhere near 500 today. I will also not be surprised if it further goes down 5%, 10%. I don't care. I mean, I would just wait. I will add some now, because 10% is already a great discount. And I mean, whatever I need to buy, I will probably, I intend to buy some of it, half of it right now, and then wait for the market open. If it further falls, then I will add to it the rest of the 50% of my intended investment today as well. So this is the story for today about the stock of United Healthcare. It's a great stock. It's a great company. It's a compounder. If you see all long term, it's just going up, and it will keep going up. There's just like a small blip here, I don't know, couple of months, 3 months, 6 months, and then it will go up here somewhere around $700-800 in a couple of years, which is like huge upside. That was it. I hope you enjoyed the analysis today, and see you in the next one. Have a lovely day. Bye bye.